And so AHEC is a kind of unique program. It's nationwide in scope, was created in the early 1970s by Congress to address health disparities in primarily rural, medically underserved areas.
I'm in charge of the pipeline here at AHEC in the Northeast region. As Health Careers Coordinator, my main focus is the pipeline. When I talk about the pipeline, I mean students starting in a high school area through their undergraduate and college term, all the way through the health profession.
It's very important that we, let these students and the people in our rural areas in the region know that health career is an option for them, and they can take that path.
For the first several years that I directed the Northeast Kentucky AHEC, we literally had done zero on the topic of the opioid epidemic within our region. And I'm embarrassed about that there was such a large problem going on within our region and that we were not doing anything to try to address it. But that's because traditionally we have done health careers promotion in schools, coordinated clinical rotations for students, and continuing education for providers. Just the more that I learned about the crisis within our region, I just felt compelled that we needed to do something.
Some of these things felt like it would never really happen. It felt so far out of reach. And so to know that these dreams, we're making those realities, it's just something I'm really proud to be a part of.
It feels good to me. Coming from a rural community just down the road, Fleming County, it's just remarkable to see the impact that we're making on the individuals in our service region and in the community. Just, being a part of a community that is able to serve.
I'm working now in the detention centers, which is completely different than what I ever expected to be doing. But it also gives me a different perspective on what's out there, what the need is. But whenever you have that, that in-person conversation with them, and you see that what you're doing behind the scenes is actually making a difference in somebody's life, it's just an unexplainable warm feeling that you want to help more.
Because of our coalition and our partners within the coalition, we had all of the resources right there to dream up this crazy idea of how that we could get involved and how that we could try and make a difference.
We're grooming and preparing our students to be great healthcare providers in any kind of form. Best way to do that is to serve their community the best way, and as we know, the opioid epidemic has taken a hold of Eastern Kentucky in a pretty tight grasp. So the idea is to get our students educated, prepared. It's impressive to see their journey, whether it be the good, the bad, the highs, the lows.
When we get together in the room, there is just a palpable synergy in that room. And I have no doubt that we are going to continue working on this. So I think we are just getting started.